It was a beautiful day for a hike. Let's talk about ticks. I'm Dr. Dan, board certified pediatrician. The area we live in, there's ticks everywhere, and we are in one of the hotbeds for Lyme disease. So what can we do to prevent ticks, and what should we do if we do get a tick on us? Most importantly, wearing light-colored, long clothing gives you an easy ability to see the tick if it's on you before it decides to dive and put its head inside you. You can also use insect repellents, things with DEET or the Picardin, or Picardin, I never know how to say that word, that you can spray on even the clothes, and it's pretty well tolerated, can help keep the ticks off you. Making sure when you come home, you check yourself up and down for any ticks, and remembering they can be very, very small, especially the nymphs, and even the nymphs can carry Lyme disease. The second thing is, what do you do if you have a tick? So if you discover a tick, the best way to remove it is a pair of tweezers, getting as close to the skin as you can, and pulling directly out. There are times that you will not get the headpiece out. The tick may rip or separate. It is gross, but there's not really much to do about it. At that point, just keep the area clean, soap and water, and watch the site for signs of active skin infection. The biggest mistake I think people make is that they worry about Lyme disease from the moment go. So you're not going to see the rash right away from that. We'll get into how to prevent Lyme disease in a little bit, but you're not going to see a red rash from Lyme disease for at least a week, sometimes even up to 3 weeks after that tick bite. The infection you get at that time would be a skin infection, so soap and water is the best thing you can do to prevent that. In our area, it is the deer tick, Ixodes scapularis, that carries Lyme disease. The dog ticks do not, but I don't expect people to be able to tell the difference. You do not have to send the ticks in to the lab to get them tested for Lyme disease. People do that. I think that's more to kind of get the general sense in the community of how much Lyme disease is out there. It's really not going to change your doctor's management. What will are these points. Is the tick engorged? Does it look blood-filled? Has it been on for more than 24 to 48 hours? Or is there uncertainty about when the tick was on you? If those cases are true, then you're at higher risk for getting Lyme disease. So this is one of the confusing things for pediatrics. Obviously, we all want to protect our kids from getting Lyme disease just like ourselves. But for adults, especially anyone over the age of 8 and teenagers and above, there is prophylaxis that can be done. Prophylaxis is preventative medicine to be given after an exposure to prevent Lyme disease. That's only done with doxycycline, and it's only been tested in kids 8 and up. So that's why it's so problematic when you have a younger child that's bitten by a tick, and they say, well, I got medicine when I got bitten by a tick. Why aren't you giving it to